the help.
I mean, well, that's what I'm here for, right? It's my role. So whatever you need me to do, I'm here to do. Just, I'm not sure how it's going to work as far as whoever is hosting. So just let me know what I am needed to do so I can be prepared.
All right, we have one more minute. Well, welcome everyone to the Suicide Prevention Awareness Summit. Let me just introduce Kimberlee Ratliff. She is a faculty advisor of the APUS Active Minds chapter and a former director of school counseling and student affair programs here at APUS. Please welcome her and everyone enjoy.
Thank you, Michelle. Well, good morning or good afternoon, depending on where you are. It is morning my time, so I still have my coffee. I just want to thank everybody for being here today to really talk about suicide prevention awareness. This topic is very near and dear to me. I lost my dad when I was 5 years old. I was a month shy of my 6th birthday. And so this has become sort of a lifelong passion for me, as well as being a mental health professional. And so this is a topic that I know can be very sensitive and very delicate at times. So if you need support, please reach out. I do have some numbers that I will share at the end of the presentation today. If you need to reach out and talk to someone, if something is triggering or you just need a space to speak with someone or text someone through the text line. So I'll share those resources at the end, but I do appreciate you being here so we can dive into this topic today. Before we get started, I do want to share a little bit about the languaging and the messaging around suicide. And the stigma is still out there. And so I like to start with this because I want us to be speaking of it to destigmatize suicide. So instead of saying committed suicide, we now say died by suicide. It really takes the stigma away from this being something related to, you think of committed a crime, just puts a negative connotation to it. So instead use something like died by suicide. Instead of saying suicidal person, we say person with suicidal thoughts or person who attempted suicide. We put the person first, rather than the suicidal aspect there. Instead of saying failed suicide, it's suicide attempt or made an attempt on his or her life. And it's really important to not use that term out of context, like saying things like a suicide mission or political suicide. So avoid using that out of the context for what it's intended. So I just start there, just so that we can kind of stay on the destigmatizing path and make sure that we're using the language that allows for us to speak about this topic in a healthy way. So I have a quick quiz for you to get started as well. So true or false, if you don't mind typing in the chat your answer here to the first one, talking about suicide will increase chances of an attempt. Is that true or false? You guys are all pros already. That is false. In fact, the research literature has shown us that actually bringing up suicide and talking about it, it gives a sense of relief to the person who may be thinking about suicide. So talking about it does not increase the chances. So I hope that opens the door for you to really talk about it with other people. Suicidal thoughts are uncommon. What do you think? I'm seeing false. Right, we're going to dive into a little bit of the statistics shortly. That's going to tell you absolutely that is false. It is rather common, and that's why we need to be talking about it. Number 3, if you're faculty or staff, which I know we may have a few in here, students performing well in classes are not at risk for suicide. What do you think? Is that true or false? Yeah, absolutely. I know sometimes If people are performing well, we might not pick up on the fact that there could be something else happening in their lives or something going on that's, producing those suicidal thoughts. What about the last one? Number 4, older adults are not at risk for suicide. What do you think about that one? True or false? You guys all get an A. That is also false. And just to give you an idea, those 75 and older, and in some surveys 85 and older, are at significant risk for suicide. There's a lot of information out there about, if an attempt is made, usually that later in life, it's harder to recover from. So we need to be taking care of our older adults and thinking about them as well. This is not just a youth problem. So to set the stage here a little bit, to give you a snapshot of statistics, I pulled some of the latest 2019 data for us to look at, and you can see that it's still true that suicides are double that of homicides, almost 2.5 times. It still ranks as the second leading cause of death for those between the ages of 10 to 34, 4th leading cause for those 35 to 54, 8th leading cause for 55 to 64, and the 10th leading cause overall. I do want to share, though, that between 1999 to 2016, there was an increase in suicide rates in all states except Nevada. And Nevada had a 1% decrease. Everyone else had increases. What's very interesting about the latest 1-year data, and I say that because we need to be very cautious to not over understand the 2018 to 2019 rates. There has been an overall suicide rate decline, particularly with white individuals, showing a significant decline of 2.2%. But there has been no significant change for other racial and ethnic groups. So just want to kind of put that out there, that yes, there has been a bit of a decline, but I also want to share that that is not uncommon, particularly when we're dealing with a national situation or, a major event like we have been over the past, year and a half with the pandemic and COVID-19. And so oftentimes you'll see a lull or a decrease, and then there will be a spike after the fact. So we're not quite to the point where we see if there's going to be an increase later. Yeah, and I see your question about military, and I don't have the specifics broken down. The CDC doesn't break it down specifically related to military in this information. You can also see by states. I like to kind of show this so you can see where your state is at. So the darker the blue is the higher the rate of suicide in those states. So just for perspective, no matter where you are living, if you're living abroad, there's also a national map. It was a little hard to put in a slide. It was hard to distinguish the different colors. So I didn't add it to this presentation, but there is a map out there if you are living in another country right now or interested in the global numbers. So broken down by race and ethnicity, this is what the graph looks like from 2010 to 2019. And you will see that American Indian and Alaska Native is the highest. They continue to be the highest rate for race and ethnicity. But I want to also point to there has been a lot of data being collected recently related to Black and African American suicide rates and how that is increasing at a greater number. And so I want to share real quickly that, even between 91 to 2017, the attempts for Black high school students increased by 73%. And we're seeing that number increase at a faster rate currently as well. And so we're going to dive into a little bit of the risk factors associated with race and ethnicity, as well as protective factors in this presentation. So I know there was a question related to military, and I do want to share there is some information related to current veteran suicide rates, that there has been a 7% decrease from 2018 to 2019, and it's it's the lowest suicide count for veterans. And I say count, it's not by rate, but by number, for veterans since 2007. However, when we look at those who identify as LGBT, their suicide risk is still increased, and increased risk for ideation as well. And you can see that with Hispanic, non-Hispanic, Black as well, that there's an increase in ideation there also. We're going to talk a little bit about this when we talk about risk factors and methods a bit, but in 2019, I thought it was important to mention that veteran suicides by firearm, that males increased from 69.6% to 70.2%, and for female from 41.1 to 49.8. So it's super important to think about that in terms of prevention and access to means, which we'll talk about shortly. So I asked you in the opening poll about whether, thoughts of suicide are common. And just to put that into perspective, 3.5 million have seriously thought about suicide, and this is within the US. And 1.4 million have made a plan, which elevates the risk as well. And so this just shows us, suicidal thoughts among US adults, and you can see the age ranges, the race, ethnicity, as well as gender represented here. Certainly, you can see the 18 to 25 age group seems to spike pretty high. I'm also super aware of the 2 or more races, which is another research interest area of mine, is multiracial identity, with my own boys being identified as Black and white. And so that is alarming to me as well, that is the highest rate of ideation for race and ethnicity is our multiracial population. So just for perspective and kind of seeing where we are with that. So we're going to take a look at the risk factors, and these risk factors have been kind of normed across all racial and ethnic groups. And so the 4 identifiers that, regardless of race and ethnicity, are a prior suicide attempt, alcohol and drug abuse, mood and anxiety disorders, and the access to lethal means, which is why I mentioned the firearm percentages related to our veteran population as well, because that's incredibly important to keep in mind, that if we can reduce the access to lethal means, then we have the potential to make an impact on prevention. Other risk factors, and you'll see some of these risk factors specific to youth as well. For a very long time, we were very cautious about linking bullying behavior to suicide. And I think the research, more recently has definitely seen an association with that. So that has been added onto the risk factors. Death of a family member or a close friend that's happened recently, history of a mental health condition. Although you do not have to have a mental health condition to die by suicide or attempt suicide or have thoughts of suicide. That's another myth out there, that there must be a mental health condition in 100% of cases, and that's not necessarily true. Relationship problems, previous attempts. Substance abuse is one that's really also important to pay attention to, because that releases or decreases our inhibitions and increases impulsivity. So if you know someone who is actively having suicidal thoughts and is engaging in any type of substance abuse, that really increases the risk significantly. So just keep that in mind. And also disability and illness can also play a role here in risk factors.
Kim, before you go on,
Sure.
I just wanted to see if you saw in the chat, Robert had 2 questions. Excuse me. What did you say about limiting access to firearms?
Oh, yes, that is a method for prevention. Typically, and if you're aware of someone who is having active suicidal thoughts, and you're concerned about them and they have firearms in the home, it is best to remove the firearms from the home. And not just for a very short period of time, but for, up to months at a time, as long as those are active thoughts, because having access to the means is going to increase the risk significantly. And because we know that over 50% of those who die by suicide use firearms, reducing that risk includes removing the access.
Okay, and his other question was, is there a reason for that age group being so high? But I'm not sure what group he was speaking of. Robert, if you want to come off mute.
Yeah, was that the 18 to 20? Yeah, the 18 to 25 age group. Yeah, so the interesting thing about the CDC is they certainly collect the information and numbers wise, but don't necessarily have all of the reasons why. So it could be related to several of the things that we're about to talk about. It can also be, developmentally, that coping skills and problem solving skills, are not quite in place. It could be, that there's more risk behavior happening at that age group. There's lots of different, hypotheses out there that we could, explore. So that would certainly take a lot more diving, into that, more specifically into the research. And certainly, if you're not aware, the decision-making aspects, of brain development are not, completely not completed, by the time you're 18. That continues on into young adulthood. So that might have to do with it as well as that decision-making piece. Thanks, great questions. So a few of the other additional factors to be aware of is social isolation, which think about what we've been in, with the pandemic right now and being concerned about those who are isolated, and even thinking about our older populations who are at significant risk, if they do not have family nearby or, they're not able to visit because of the restrictions and the social isolation piece that the pandemic has brought into our world, in the recent recent year and a half or so. Financial problems, so significant debt, and financial stress can certainly be a factor. Unemployment, which also the pandemic introduced as well, for a period of time. Criminal charges and engagement with the legal system, a serious illness, and impulsive or aggressive tendencies can also be some factors involved that lead to attempts or death by suicide. So we've talked about some of the general factors, and I wanted to really give you a little deeper into the racial and ethnic specific risk factors. I think this is incredibly important and things that may have been missed over time. And so I've broken it down by several of the different groups here, and you can see some of these specific risk factors, such as, family conflict, such as, acculturation, discrimination, violence, bullying. There's a lot of different aspects of different racial, ethnic, specific risk factors that we need to start paying attention to, that are more systemic in nature, such as when we think about our American Indian and Alaska Native populations. There's historical trauma, relocation, removing languages, their traditional, ceremonies, trying to integrate into white culture. And so really paying attention to some of those things that can be associated with suicide risk here. A very interesting research study also looked at marital status for Black families, and those who are divorced or unmarried are at a higher risk of suicide than those who are married or and have a, an intact marital situation. However, family conflict, is also something to consider. And this includes even parental conflict. So for adolescents, that can be an increased risk if parents are fighting all the time, or, there's not harmony in the family at home. So I bring that to everyone's attention because I think we need to be looking at these systemic factors across the board. And to bring in LGBTQ as well, family rejection is increases the risk by almost 8.5 times for attempted suicide. So that's something to really pay attention to as well. So another little quiz item time for you. Which factor do you think is the most significant of some of the ones that we've talked about so far? You can just put A, B, C, D, E, F, or D in the chat. I'm curious, which one of these do you think is the most significant in terms of suicide risk? All right, seeing all kinds of different responses here. Yeah, a lot of you thinking job, financial. Yeah, so just to clarify, all of these are contributing factors, right? So, so you're not wrong on all of these, but the most significant is D, relationship problem. So if you are, if you have a friend who is going through a divorce or a separation, or, you're working with youth, or you're talking with, your niece or nephew or whoever, and they've had a breakup, those are some times when they're very vulnerable. So all of these can contribute for sure. You're right. That D, relationship problem, has shown to be the most significant. And here's the actual statistics behind that. With the CDC study here, relationship problems account for 42%. In addition to risk factors, it's also necessary for us to understand protective factors, because this is where we can really make a difference and support our family, our friends, our colleagues, our neighbors, in prevention. And across all racial and ethnic groups, there are some specific protective factors that are pretty generalized among all of them. And that's life skills, so problem solving and coping skills, connections to friends, family, and community support, so that social connection and being part of society is really important. Cultural, religious, and personal beliefs that discourage suicide, access to physical and mental health care, and limited access to lethal means among those that are at risk, which we've talked about as well. And for youth, you can see, closeness with caring friends, school safety, connected to other non-parental adults, parent connectedness, academic achievement, awareness of the resources that are out there, and just safety in the neighborhood as well as overall resilience. So there's things that we can do, there's environments that we can create that can help to protect those who may be at risk. So again, I like to break this down by racial, ethnic, specific protective factors. So you can see how these connect. And the studies show, various things. I think it's really fascinating here. If you're in education or thinking about, your own, young people that you work with, that, for Latinx youth, caring from teachers is on the list of a protective factor. You can see social and emotional support is huge here. Identity, connection to your specific identity, positive role models. There's lots of different spirituality, you know, cultural identification. There are a lot of different aspects that don't fall into the general research. But when you break it down by race and ethnicity, these are some important things that we need to be creating, not just for our youth, but for everyone. I'll give you just a minute to look at those. So we've talked about risk factors, we've talked about protective factors. We're going to jump into warning signs, and I like to use the American Association of Suicidology's acronym IS-PATH-WARM to be thinking about if some of these things are present that might introduce or just give you a clue that something isn't right and you need to check on this person. So some of those things are suicidal thoughts, so ideation, substance abuse, which we've talked about, a feeling of purposelessness, like not finding a purpose in life can be a clue, anxiety, feeling trapped, feeling hopeless, being withdrawn, anger, recklessness, and mood changes. And I do want to note that for mood changes, it can be that maybe this is a person you tend to see, you know, happy and social, and all of a sudden they're withdrawn and moody and just, you know, feeling depressed. But I also want to share with you that you also might notice someone that may experience depression or deep sadness, and all of a sudden their mood is lifted. And I bring that to your attention because sometimes what that means is the person has made the decision, they have a plan, they feel like they have their way out, and so their mood is lifted at that point in time. And so it's you know, I think we tend to sometimes think of those going into a depression might give us the red flag that something is going on, but the opposite can be true as well. So some of the statements of concern that you might hear, it's just so hard to get out of bed lately. I can't deal with life right now. I want to fall asleep and never wake up. Everything's just too much. I can't handle it. I won't have to deal with this much longer. So those statements of concern, they might not come out. In fact, they most often will not come out and say, I'm feeling suicidal, or I have a suicide plan. That's probably not the language they will use. And so just being tuned in to some of these statements of concern and being aware that there might be more to explore, and it might be time to ask a question. So here are just these high-risk warning signs: direct communication, verbal or written, and a lot of youth. I've worked with a lot of adolescents, and often journaling, their journals, their folders. There might be things, you know, where they're talking a lot about death. And so that can be a direct communication. Has a plan. If they have a plan and they have the means to carry it out, that's going to significantly increase their risk. And I know we talked about access to firearms already. I do want to clarify, this is not saying, this is not a constitutional stance. I know that has been a very controversial topic in the media as of late, and this is not a constitutional stance. This is a safety stance of, I need to keep this person safe in terms of removing that access to their firearms. Putting the affairs in order and giving away possessions, saying goodbye to friends and family. And I already mentioned the mood shift from more despair to calm, relaxed, even happy, you know, can be present as well. And I share this picture because I think sometimes we imagine that people who are smiling and seem happy on the outside, that everything is great in their world. But there might be other things happening behind the scenes that are just not in our awareness. So it's important to know these signs and these risk factors to be able to notice that and be able to bring it to the forefront so that they can get some help. everybody on this call, I do not expect that you're a mental health professional. The work that we do is certainly takes a lot of training, a lot of education, a lot of work to work with our clients that we see that may be having these suicidal thoughts. So you might be thinking, okay, I'm not a mental health professional. I don't have that training. So what in the world can I do about this? And I think probably the last maybe 5 or 6 years, I've loved how these tips have been given to a broad audience, because suicide prevention is not just a mental health professional thing. It is all of us working together. And so there are steps in the Be the One To campaign that I wanted to share with you, just to give you some empowerment and equip you with the steps to take if you are concerned about someone. And the first one is to ask, are you thinking of suicide? You have to be careful how you ask. You don't want to say something like, you're not thinking about suicide, are you? That would add shame and embarrassment, or judgment to the person. So asking, are you thinking of suicide? Are you thinking of killing yourself? Being just using the words and bringing that up. And remember, in our myths that we kind of debunked earlier, bringing that up is not going to make them think about it more or attempt. It's going to, for the most part, what research says, it's kind of a relief of, oh, wow, you noticed. I don't feel as isolated because you notice, and I'm not alone in this, because that something isn't feeling right now for me. And then be there, listen to what they need, listen without judgment. You're not there to fix the problem, but just being a listener and being there can make a world of difference. We've talked so much about reducing the access to means, which is incredibly important, and then connect them to their support and their resources. And the one sometimes that we forget about is that if you do have a friend, a family member, someone in your life that you're following these steps with, don't forget to follow up and check in with them. This isn't just a one-time, oh, I asked the question, I got them help, so now I'm good. This is an ongoing thing. We're just continuing to follow up, continuing to check on them, and let them know that you're still there for them. One of probably the most often that I've heard is, I just don't know what to do. This isn't my profession. I don't really know what to do. And so I hope these steps give you some empowerment and feeling like that there is something that you can do in that moment. And you're not there to fix. You're not there, to make things all better. But you're there as a source of support and providing that protective factor of connection and support in that space can be a tremendous help for those who are struggling. Any questions about those steps? Okay. All right, so just a few other reminders when you are supporting someone in distress, identifying support systems. You probably noticed that even across all the race and ethnicity groups, that having that connection and that sense of belonging and that support system is a protective factor. So identifying those support systems, finding out what is it that is going to help them feel connected and not make that decision to follow through with their thoughts or their plan. Share resources, and I have a list of resources that I will be sharing with you in just a few moments. And do not leave the person alone. That is a huge one, and one that if this is an active suicidal thought and they have a plan and you're very concerned, getting them to a professional or getting them to someone who can work with them in that space that has the training and expertise to do so is very important. So do not leave them alone. And lastly, take care of yourself. This work is heavy. I talk to my grad students all the time that are becoming mental health and school counselors. I talk to them all the time about taking care of yourself, and that's very important. There is something called, compassion fatigue, where you're hearing and you're working with people who are really having very difficult situations and really struggling to find purpose in life and a reason to be around. And that can be very weighing on you as well, as a helper, as a friend, as a neighbor who's trying to get someone help. And so remembering to also take care of yourself and engaging in your own self-care when you're helping other people is something to keep in mind so that it doesn't negatively impact your own mental health as well. Yeah, great question about hotlines. So yes, I'm going to share those in just a moment. So there are so many mental health resources out there. The crisis text line, for example, and they have seen a tremendous increase during the pandemic of people reaching out to them. Typically, the youth populations use this service most frequently, but it's for everyone. So 741-741 is that crisis text line. The National Suicide Prevention Hotline is also available, and they do have a text option as well, I believe now. And I also include some other really important hotlines on here too, because my hope is that you will keep a list of these somewhere prominent, either a place in your office, on your refrigerator, in your wallet. Keeping these numbers handy when you need them will prevent that chaos and urgency of, oh, I need to find the number. How do I find the number? Where do I find the number? So having them somewhere that's easily accessible can help decrease that panic in the moment and get that person help immediately. The Trevor Lifeline, great resource for LGBT populations, Eating Disorder Association helpline as well. Many people do not know that eating disorders is one of the most fatal mental health disorders. So it's super important to include that as well. The Trans Lifeline has a little shorter window of time in order to reach them, but that is also available. I think that was developed in the past just a couple of years or a few years, mainly related to the fact that 40% of transgender adults have made a suicide attempt. That's a tremendous amount. And so they've created a lifeline specifically for that population. And of course, the Veterans Crisis Line as well, Lifeline for Vets, which they also have both text and phone number as well. So those are great resources to have on hand. I keep a copy of them on my fridge. I keep one in my office. My husband, who is now a veteran after 21 years of service, has a card, I know, that the military provides with some of the numbers in his wallet, because you just never know when you're going to need that information. And if you are here at APUS, I wanted to share some specific resources here as well. For faculty and staff, I know we have the Employee Assistance Program, and we now have You Will, which I'm super excited about, who will be presenting after this session. Adam will be joining us from You Will with teletherapy for our students specifically. Military One Source is also available. And I see our chaplain is in here with us today, Dr. Lindemeyer. And so I have that information as well. And I know that we also have other chaplains. I apologize for not updating that with the others that have been added in the past year or two. But we do have resources here at APUS as well. So I want to make sure you have those. Okay, so we have time for added either just dialogue or questions. If anyone has any questions, I do have a few references of some of where my data came from today. I try to pull from the most recent information. And as you know, sometimes statistics, it takes a little while for them to compile their reports, but we do have the most recent data that's available that I presented in this presentation today. questions, thoughts, anything you thought of as we talked about risk, protective factors, contributing factors, some of the statistics, anything stand out to you? Of course. This is definitely my passion, Caroline, so thank you. I appreciate that.
Looks like Ree has her hand up.
Okay.
Hey, Dr. Ratliff.
Yeah.
Great job, as always. You know, you're one of my mentors and heroes. But not friend to friend, but now student to professional, a question. What would you recommend that people in my position of being just a general life advocate, right? But I'm not a professional, right? So we have the AR, and I saw the tool you just shared too, although I've already forgotten the name. I'll review the slides.
Yes. Be the one too. Yeah, be the one.
Be the one too. Thank you. What advice would, like verbal advice, I guess I would say, would you give to someone who's not a professional, but tends to be someone that people will turn to and lean on? What advice would you give to us to, I guess, not say the wrong thing, right? My son happens to be one of these people too. He's only 14, and kids who are struggling tend to gravitate to him, which he's very honored by. But he always feels like he doesn't know what to say, right? So I encourage him. The fact that they're coming to you says your light is shining, but he's afraid to say the wrong thing as well, even at his age. So just kind of verbal things that we can maybe do or don't do, right, for like a general public. I know you have lots of wisdom in that area, so I'd love to hear anything you can share.
Sure. And I'm glad that you brought that up, because oftentimes our kids and the adolescents and pre-adolescents and even younger children might be confronted with that with their friends, right? And that can be a really difficult place to be in when they're constantly, you know, the trusted advisor and trusted person that they're going to share with. And kids typically will tell a friend before they will come to an adult. We know that. So my advice with that is, I think practice is super helpful, and really kind of planning out the words that you would say. So for example, when a young person comes, you know, say, I really care about you. Thank you so much for sharing. I appreciate your courage in sharing this with me. I really care about you a lot, and I want to make sure that you have someone to talk to that can, you know, really help you with this, and try to make it normalizing in terms of going to the school counselor or the school psychologist, or, you know, someone that can help address, you know, the issue at hand, particularly when it comes to suicidal thoughts. So kind of normalizing that, but also just saying, thank you so much for coming to me. I really appreciate that you trust me in that. And I care so much about you. I don't want anything to happen to you. So will you come with me to the school counselor office? And really invite them and kind of get them to join in that. But I think for our youth, helping them to practice that language and it becoming second nature to them, so that it's not a panic moment in the moment, and they're able to verbalize that and use those words that are both soothing, supportive, but also get them to professional help, because our kids can't bear the burden, right? They can't bear the burden of something happening and thinking that it's their fault because they should have been able to fix it, because that's not their job to do. Is that helpful, Ree?
Yes, thank you so much. It just reminds us all of the fact that anyone can be there for anyone at any given point. But I love the point that you stressed of, this is something I struggled with when my grandfather completed his second attempt at suicide, and that I felt guilty forever because I couldn't, quote unquote, stop it, right? And if I had had this type of training when I was younger, maybe I wouldn't have suffered so long. So keeping in mind, like you said, that to remind them to normalize the language, but also it is never their fault if someone else hurts themselves because of what they said, right?
Mhm. Yeah, yeah.
Well, while trying to be helpful, let me clarify.
Yes. Sure. Yeah. There's ways to be supportive and just telling somebody that you care about them, that you don't want anything to happen to them, but also recognizing your limits, whether it's kids or whether it's a adult non-mental health professional, that's not your lane, right? And so bearing that burden, something you said to Ree that I think is so important for survivors of suicide loss to hear, that guilt is common. And I think about even as a 5-year-old, dealing with the death of my father, throughout life, there's been moments of guilt. Is there something we could have done? Is there something I could have done? Did I do something wrong? Right? As a child, you start to think there's something that you did that caused, something like that to happen. And so that guilt is totally normal, with survivors of suicide loss. But yeah, it's not, the burden to bear. But sometimes those emotions come with that when you've lost someone. I see another question here in the chat. Let me make sure I understand what would you recommend somebody do? Oh, wait, I just lost it.
Do you want me to read it for you?
Sure.
It says, what would you recommend somebody do when a friend or etc., not a fellow employee, do when their friend's mood or disposition is different and they say everything's okay?
Yeah, that can happen, right? And I think just asking the questions and continuing to ask questions. Certainly, it's really hard when someone's like, no, everything's okay, everything's good. But I think being persistent and continuing to ask and continuing to check in, and continuing to involve them in your social life in some way, so that they have that connection. It may be that they are just not comfortable talking about it. And I think the more that your presence is there, that it might open up to where they're willing to answer it differently. But that's a really tricky one. It definitely is hard when someone's not willing to admit and say. What I would say with that too is sometimes even just normalizing it, and saying, it seems like you've been going through quite a lot lately. And, I've noticed that you seemed a lot more sad than usual. It wouldn't surprise me there, people get in those, those thoughts sometimes where they just want everything to be over. Have you ever thought that? And just kind of opening the door to those questions. And then just blatantly asking, have you ever thought about suicide? Because you never know when that everything's okay might turn to actually, yeah, I have. And you might be the person, to get them to those resources. Yeah, thanks for the motto. I just saw that, Ray, you matter. And we need you here. That's something that I love. I'm glad you said that, because I like to end my presentations often with that phrase, is Active Minds, we need you here. And that's a message that we like to portray to everyone, that, there's life brings a lot of struggle. Life is not nice sometimes, and life is totally cruel sometimes. And, it's something that you have to adjust to. And if you don't have the coping skills, you don't have the support system, then, it can bring up thoughts of just giving up. And we don't want people to give up. We want them to be here. Speaking of, and I think this story might help as you're thinking about talking to people that or maybe it's someone that you're concerned about. So I did some Red Cross work in mental health during the hurricane season. I know it's been a while now, but Hurricane Katrina and Rita and Wilma that hit just back to back to back. And I was conducting a suicide assessment with a young lady who lost her business At the same time, she lost her relationship. And in conversation with her, she revealed that she did have thoughts of suicide, and she was thinking about it. And when we think about those protective factors that I talked about, sometimes protective factors can just be that one thing, and it can be something really small that is useful to that person to think about in the moment, that helps them find a purpose for living. And in this case, I was talking to this, doing the suicide assessment, and I said, is there anything at all you can think about that would keep you living? Like what would keep you living? And she goes, oh my gosh, I can't leave my cats. My cats, I'm the only one that I can take care of my cats. I can't leave them. And in that moment, we changed from a suicidal assessment to, oh, so what's your plan, to make sure that you stay in that space, and that you're thinking about, the people who do depend on you and the cats and that type of thing. And a similar thing with a young child that was just going through a really, really challenging, traumatic home life situation. And in the conversation said, I'm just not going to be here after this week. And of course that triggers, okay, I need to find out more information. I need to know what's going on here. And I remember the week prior that he had someone brought McDonald's to him at school. And he was talking about, his favorite chicken nuggets and all of these things. And I said, oh my goodness, I said, you wouldn't be able to go to McDonald's ever again. And he went, what? And so finding that little piece of what would keep them alive, whether it's for this kid, those chicken nuggets that he loves, or the cats, for someone, or, whatever they can cling to, you get very, very concerned. And it's a huge red flag if they can't come up with any possible reason to stay alive. So shifting that conversation to what's going to keep you here. We need you here, so what's going to keep you here is a conversation you can have too.
Kim, there was one question in the chat from RKM about what about people who may be affected by alcohol or drugs that misread your intentions? How do you try to help with that?
Okay, can you give me a little bit more information? I don't know who misread your intention. So I'm not quite sure exactly what that's asking, but I would love to answer. Yeah, can you go off mute and tell me a little bit more about what you mean? Or maybe typing. Okay. That's really hard to get kind of the bits and pieces of the story. But in terms of misreading intentions, yeah, in terms of misreading intentions, the thing that I will say is if you go in trying to help someone, you're being a friend, right? You or a colleague, or you're doing what's right for them and what's best for them. And so I say the same with, like, for Ree's example, with, her son being the one that people go to, not promising, like, please don't tell anybody this, but, don't go into those conversations saying, oh, this is just going to be private between the two of us, because you can't carry that. And definitely need to get them connected to some professional help and professional support. Okay. Yeah. With addictions, it can be really challenging because those patterns, those patterns of behavior are impaired by, whatever they're using, and that draw, to get whatever they're using as well. Those situations can be super difficult, but getting them connected to that professional help is the best that you can do. Yeah, thanks, Cynthia. So with that, I'm seeing several of you thinking about different situations and, what could I have done? And I just go back to those steps that I shared, the be the one, two, really following those steps. You can't force someone to do something, right? Unless they are actively in an active suicide and you need to get legal involvement and there are other things happening in that situation. If it's something with coworker and at work, hopefully there's an HR process, or there is, a manager process that can get you connected to the resources that you need in that specific situation. Because sometimes with coworkers, they might not be, it might not be a close friend where you feel comfortable doing all of those steps. But if you're noticing the warning signs, alerting the right people, I would say is your best step there, is just knowing who to go to in those situations at your workplace, and making the right steps to get them to that person. Yeah. In the heat of the moment, that can certainly be challenging, right? Because if you don't know exactly the reason for the behavior, and take it more personally, sure. Mm-hmm. Sure. And the good news is, now, right? It's a situation that you learned from that, hey, maybe I could connect them to, but don't own the behavior of that person as your own. Try to separate those two. Thank you all so much for joining me today. It's a little early my time, so I apologize if my words didn't come as clearly as normal. Recovering from a busy week, but I do certainly appreciate you being here. And I hope that just being aware of the risk factors, the protective factors, and those specific to different ethnic and racial groups that I think we need to pay closer attention to. I hope that's helpful, and I hope you have some strategies and some ideas of how to be that support, for others when you start to notice any warning signs that might be present. So I do appreciate you today. Remember, we need you here. If anything in this presentation was triggering or you need to talk with someone, I want to refer you back to the resources here on this page. I know the crisis text line specifically, yes, they deal with those who are, having suicidal ideation, but they also are there for other reasons as well. If you just need a place to talk, I know that they are available for more than just that immediate crisis situation. So please jot those numbers down, keep them somewhere handy for you. And if I can be of any further assistance, certainly feel free to contact me. I'll leave my email in the chat here.
And while you're doing that, I see Ree has her hand up. You'd like to make a comment?
I did. I just wanted to address I think maybe Kim didn't see it, but Miss RKM, you said, right, I don't blame myself there at the end. And I just want to reiterate Dr. Ratliff's point that you would not blame yourself. No, because you were trying to just be there for someone that you didn't even know very well. And that's the part that you can do. Right, Kim, I felt like you probably didn't see that comment and wanted to address it before you left.
Yes, thank you. No, I did not see that. Thank you.
Well, I think as we're wrapping this session, we have a half an hour break before the next session begins. That will be with our You Will partner, which I think will be really great and informative to learn more about You Will. So we're looking forward to seeing you back in half an hour at 1:30 Eastern time.
Okay. Thanks, Jenny.
Thank you.